If you're watching this video right now, it might be because you're concerned about something that's popped into your head that you might be worried is blasphemous or against some kind of religious belief that you hold on to. It can go further than normal and natural when it gets to a point of not being able to dismiss the thought or move on from it. When it comes to a point where it's stuck in your head and it really bothers you a great deal. Maybe what you're actually experiencing is something that we call scrupulosity obsessive-compulsive disorder. My name is Dr. Patrick McGrath. I'm a licensed psychologist and chief clinical officer at NOCD, and my specialty is working with people who have obsessive-compulsive and related disorders. These are normal and natural types of things that many people experience who are religious, but in those average everyday doubts that people would have about their religious beliefs, they would be able to either A, get an answer and be satisfied with it, or B, recognize that, okay, you know what? I'm not perfect, I'm a human, and I'm gonna be okay with it. Now, you might say, OCD, no, that's just washing your hands or checking your locks, but OCD has so many various types and subtypes that occur. You may be worried, did I want that thought to be there? Did I cause it to happen? And if I don't do something to get rid of it, what will happen? Now, note that scrupulosity can take on two forms. There can be a religious side or a moral or ethical side. Today, we're going to focus more on the religious side and specifically along the lines of, what if I've done something that's offended my God or higher power? What we're going to do is talk about scrupulosity OCD and how the cycle of it works, what treatment for it might look like, and some things that you could do to get help if necessary. There's a cycle that you will find yourself stuck in scrupulosity OCD. Typically, it starts with some kind of a trigger. It could be something that you read or something that you've heard, and it triggers in you an obsession, an intrusive thought or image or urge that maybe you didn't have the right thought about your higher power, or maybe you made a mistake in a prayer, and what if you did that purposely? Or what if you see someone else being better at being holy than you are? And what does that do? It right away leads you to want to do a compulsion. What is a compulsion? It's an act that we do behaviorally or mentally as a way to try to fix the situation and neutralize whatever the obsession was. So you might find yourself saying that prayer over and over and over again till you've done it just right or perfectly, or you might find yourself actually going to church every single day because you think if you don't, then you're not being as holy as your neighbor who does go to church every day, right? But in doing that, recognize that nothing is quite hitting the mark. Nothing is absolutely telling you that you are safe and your salvation is secure. And so this leads to more doubt and more insecurity, and you find yourself seeking more and more of this reassurance and doing more and more behaviors to try to get that 100% feeling that all is well with me and my God or higher power. If this sounds like you, where you're stuck in one of these cycles and continuing to do these things, all to neutralize discomfort, that's a cycle that we need to work in breaking. Because otherwise, what you will notice is that it will just take over everything in your life. The likelihood is your higher power is not looking for perfection. Your higher power is looking for a relationship. OCD is looking for perfection. And we have to make some decisions here. Are we here to serve the higher power that we believe in? Or are we here to do the bidding of what OCD wants us to do? The treatment for obsessive-compulsive disorder involves exposure and response prevention therapy. It really involves two things. First, purposely being exposed to whatever that thought is. That's the obsession/exposure piece of the work we do. And then not doing the compulsion. And that's the response prevention piece of the work that we do. Let me walk you through how we might break that cycle. Whatever it is that you have, whatever kind of intrusive thought religiously you experience, I want you to conjure it up right now. Pull it into your head. Now that it's there, I want you to allow it to be there purposely, without doing something to neutralize it, without doing something to make it go away. Just let it be. As you're doing that, you may notice that your anxiety or discomfort is going up. You may even feel guilt for even doing this exercise. Remember, normal, natural things that OCD utilizes to try to get you to do compulsions. But stick with me and don't go into doing that compulsion. Over time, my goal is this. You'll realize that the discomfort you're experiencing goes down naturally on its own without you having to make it go down. And when you realize that, and you learn that you can handle this without a compulsion, you will start to break the OCD cycle. You will actually start to feel better. things will start to feel more natural to you, and you'll start to live the life that you want to live instead of the life that OCD wants you to live. That was one sample of what ERP might be like for Scrupulosity OCD. No matter how you might experience scrupulosity though, know that there are trained therapists out there available to help you. If you're going to seek out a therapist for OCD, make sure that you find someone who is specialized in the treatment of obsessive-compulsive disorder. That's really important because a general kind of talk therapy might actually reinforce some of the different things that you do in OCD, like seeking reassurance or distracting or something like that. And we want to make sure that doesn't happen. Ask any therapist that you're going to see if they utilize exposure and response prevention therapy for OCD. You'd want that answer to be yes. Also, ask a therapist how many people they've treated who have OCD or anxiety-related disorders using exposure and response prevention therapy. You'd want a significant amount, or be sure that they're being supervised by somebody who has treated a great deal so that they can get the supervision needed in working with you. If you yourself want to start seeking out some help, lots of places that you can go. One is the International OCD Foundation website. They have a great service directory of therapists available across the country, and you can also check out NOCD as well too. You can get connected with a licensed OCD trained therapist right on your phone. You can download the NOCD app or go to the NOCD website and book a free 15-minute call with one of our team. You'll start by doing face-to-face sessions with your OCD therapist, and between sessions you can message your therapist for support, you can join our peer-led support groups, and at any time you can use the NOCD platform self-help functions as well. We'll include a link in the description below, as well as resources from Healthline to help you with your intrusive thoughts or images or urges that you experience around scrupulosity-based OCD. Please know this, you're not alone and help is available.